Well, extraordinary measures are being used to stem the novel coronavirus, even as it spreads right around the globe. The deadly virus has now infected nearly 94,000 people in 77 countries and territories. More than 3,200 have died. Italy says it's now going to close all its schools and universities around the country until mid-March to stop the outbreak. And South Korea's government will use a GPS app to monitor those in self-quarantine. And in the Iranian city of Qom, no one who appears sick is allowed to leave. Christian Armenpour reports.
A worldwide shortage of protective equipment is hampering the response to the coronavirus outbreak and leaving countries scrambling to prepare for public health emergencies. Rapidly depleting supplies of goggles, gloves and masks have left doctors and nurses dangerously ill-equipped, according to a new warning from the WHO, the World Health Organization. China announced a further drop in new cases, raising hopes that the outbreak is beginning to level off there, the hardest-hit country and where it erupted. But across Asia, the number of confirmed infections continues to grow. In South Korea, where a spike was recorded, authorities are battling the contagion with technology. A GPS-based app is expected to monitor thousands of people under quarantine and set off an alarm if they leave their designated locations. Iran, one of the worst affected countries, will activate a 300,000-strong team of healthcare workers after reporting more than 90 deaths from the virus, including an advisor to the supreme leader. An outbreak of the virus in Iran's prisons prompted the temporary release of more than 54,000 inmates, including the British-Iranian Nazanin Ratcliffe. And the country's parliament has been suspended until further notice after some 23 lawmakers tested positive for the coronavirus. Across Europe, authorities are taking early precautions to stop person-to-person transmission, and several governments have banned large-scale gatherings and have closed some public places. Italy announced a significant increase in its death toll, bringing the number there to almost 80 dead, and most of them living in the north of the country. The disease and its knock-on effects have rattled markets all over the world, and a sudden interest rate cut by the U.S. Federal Reserve on Tuesday was designed to stimulate the economy and could be followed by similar actions from other countries. As for developing nations grappling with their public health response, the World Bank has now committed $12 billion in aid. Christian Armenpour, CNN, London.
Well, here in the United States, the death toll has now climbed to 9, while the number of infections has risen to 127. And the Center for Disease Control and Prevention is urging local communities to encourage social distancing to reduce face-to-face contact. Well, for more, I want to bring in CNN's Clare Sebastian, who's tracking the market reaction, as well as senior medical correspondent Elizabeth Cohen. Good to have you both with us. Elizabeth, I'm going to start with you because so much of this revolves around the numbers we are seeing. And the World Health Organization has just come out with some new data that shows that the coronavirus is significantly more deadly than the seasonal flu. But the silver lining is that it's not as contagious.
Right, and we should take both of those things as something that is true right now, but might not be true in the future. And the WHO is very clear about this, that this keeps changing. So what it looks like right now is that the difference in the mortality rate is sort of roughly, it's 3.4% approximately for the coronavirus. The flu is much lower than that. But that number could come down because as we discover more and more cases of coronavirus, that means that the mortality rate goes down. More non-fatal cases, that means the mortality rate goes down. And this is perhaps even the more important part, which is that it appears that coronavirus doesn't spread as easily. And they think that's because while both of them can be spread by people who aren't yet sick, it seems to happen more with the flu. Again, those things could change. We could be told later on, you know what, actually, it does seem to spread more easily asymptomatically, or you know what, the mortality rate is a bit lower or a bit higher than we thought. But for now, what we think is that the mortality rate is higher for this new coronavirus, but it doesn't spread as easily as the flu.
Right, okay. So we are seeing around the country a lot of, not just in the US, but obviously around the world, people stockpiling on toiletries and food, toilet paper shortages we're seeing. Is that an overreaction, or should people actually go out and buy some things just in case the supply chain is so affected that we can't get basic essentials?
You know, what experts have told me is think about what you would do for any other kind of, or for any kind of disaster. So, for example, here in the U.S., there's a lot of advice about what to do in case of a blizzard if you live up north, or a hurricane if you live in an area that's prone to hurricanes. And the advice in that case is to have 2 weeks' supply of food and water. And that's also the advice from the U.S. government for a pandemic, which we're not in right now, but which this could become. And so 2 weeks supply of food and water, you could maybe, extend that obviously to toilet paper, another thing that you don't want to live without. And so, it's, when I hear stockpiling, I hear like enough toilet paper for the next decade. You don't need to do that, but it is never a bad idea to have 2 weeks of toilet paper in your home, as well as a 2 week supply of your medicines, which is perhaps the most important. Food and water. Think about what you would do in other situations. There is a chance wherever you live that you will be told that you need to stay at home for 2 weeks. There is a chance that you could be quarantined. And so you want to think about that in advance. And a 2 week supply of those kinds of things is not a huge amount. Many of us may even already have that in our homes.
And obviously here in the US, the Center for Disease Control is no doubt concerned that there may be cases out there where people have the coronavirus and it's undetected. They don't know about it. So I understand from this piece you've written online on CNN.com that they're setting up these surveillance labs to try to detect those people. Just tell us about that.
Right. So there's been a lot of question about whether there's coronavirus out there that we just don't know about, because many younger and healthier people just they get no symptoms sometimes, or maybe they get a runny nose and a scratchy throat. You don't think coronavirus when you get a scratchy throat and a runny nose, or at least you haven't up until this point. So it is possible that there are many more cases out there that we don't know about. It's also possible, because China suppressed information about this virus in the beginning, that people flew from China to other parts of the world, including the U.S., in the sort of December 8th, January 15th time period. In fact, some modeling shows that that did happen, that there were a few cases that went from China to the U.S., and that may have spread the disease even before the U.S. really started talking about it. So the surveillance sites that are being set up that Lynda just mentioned, there are surveillance sites all over the U.S. during flu season. And so when people come down with signs of the flu, they test people for the flu. What the U.S. is going to start doing is when people don't have the flu, when those specimens are negative for the flu, they will then test for coronavirus. This was actually announced weeks ago. They're not quite up and going at full force because there's been this problem with a shortage of tests. But once that shortage is gone, then hopefully they will be up and going. And we may find out that there's all sorts of cases out there that we didn't know about.
And that indeed will then lower the mortality rate, possibly, if there are many more cases out there.
For sure.
All right. And Elizabeth Cohen, thanks so much. I want to go to Clare Sebastian in terms of the impact we are seeing on the markets. And Claire, obviously the US Federal Reserve slashed interest rates yesterday in what was the first unscheduled emergency cut since the 2009 financial crisis. The hope was that it would ease investors' concerns, but clearly it had the opposite effect. How are things looking now?
Well, things are bouncing back a little bit today, Lynda. I think that probably has slightly more to do with Super Tuesday and the strong showing by former Vice President Joe Biden. The biggest gainer right now on the Dow is United Health. That is up some 12%, a relief rally, I think, because many people on Wall Street were worried about Bernie Sanders' policies of a sort of national healthcare system. But in terms of what the Fed did, well, this was a very fine balancing act for them. They were sort of backed into a corner a little bit by the markets, who are really pricing in the prospect of not only a 0.5% cut, but a sort of unscheduled one, or increasingly start to. So they risked doing nothing and spooking the markets, or doing something and using this tool reserved in the past for the likes of the collapse of Lehman and 9/11, and risk spooking the markets as well. So it was sort of a lose-lose situation for them. But it's interesting because this is similar in a way to what we saw the Fed do last year with their 3 cuts. What they were doing in this case was really an insurance cut, trying to get ahead of this really showing up in the economic data that we see in the US. Right now, we're only really starting to see very small signs of it appearing in sort of manufacturing and sort of business activity data. It hasn't shown up yet in consumer confidence, hasn't shown up yet in jobs. We may get more details on that when we get the February jobs report at the end of this week. But the Fed making it very clear they're trying to get ahead of a drop-off in economic activity by doing this.
All right, Clare Sebastian, as always, thanks so much for joining us. We'll have to leave it there for now. Thank you. Well, for the latest on the coronavirus and to separate fact from fiction, you can subscribe and listen to our podcast. CNN's chief medical correspondent, Dr. Sanjay Gupta, is making sense of the headlines, speaking with experts and giving you all the information you need to stay safe and healthy. We are going to take a quick break now. You are watching Connect the World. We'll be back with much more news. Stay with us.
At Jeffco, our hearts beat to the rhythm of our customers' needs. We go the extra mile, unlocking your logistics challenges with our truly global network. At Jeffco, we are partners, unlimited. Inside Africa, in association with Zenith Bank.
Outside the town of Rustenburg in South Africa's northwest province is a canine training academy pushing the limits in the war on illegal poaching. Providing comprehensive training tactics to everyone from police and special forces to border patrols and military canine units, this academy is where dogs and their handlers come to prepare for their mission of saving endangered species across the continent.
We will continue to fulfill our role working with the actual rangers on the ground, the police officers and the military in assisting them to apprehend the baseline poachers that's decimating the African continent at the moment.
Today, we live in an unpredictable environment and news races around the world at breakneck speed.
Are you playing with fire?
My show brings you the latest news and top news makers.
Guten Tag. Hello. How are you? I do not understand the United States.
And we also dive below the headlines to explore vital issues impacting our lives.
It's about right and wrong.
Does love have a chance of winning?
I've always believed that.
Amanpour, tonight on CNN.
I'm Matt Rivers in Yokohama, Japan, and this is CNN.
We've got some breaking news just into us in the US presidential race. Michael Bloomberg has just dropped out after what was a poor showing in the Super Tuesday primaries. Bloomberg had spent hundreds of millions of dollars on advertising. Now the big question is, will he throw his support and money behind Joe Biden? My colleagues Jim Shudo and Poppy Harlow have more.